Hello, beautiful people. How you all doing today? I hope you're fine. I hope you are well. I hope you're enjoying yourself wherever you're watching me from. It's good to have you here with me. It's been a very long time, yes, I know. And I do sincerely apologize for my absence. From the last time you saw me tonight, a lot has happened. Anyways, I'm not here to bore you with the story, but you're welcome back to the channel. This is my first video of the year. Happy New Year to you all. Happy New Year. I pray and hope it's been a great year for us all. Amen. And in today's video, I'm going to be starting a series on the female breast. And then the three most common complaints that I have seen relating to the female breast, are breast pain, nipple discharge, and a palpable mass, or if you like, a breast lump. Now, we'll be taking them one by one. For the purpose of this video, we'll talk about breast pain. Now, a woman with any of the three symptoms, anything at all about their breast, the first thing on their mind is they are afraid, panicking, they are worried that, oh, is this a malignancy? Is this cancer? That's the first thing that comes to your mind. Concern, like deep concern, serious concern. So the aim of this video is to educate us. To educate us that not everything about the breast is cancer, and then sometimes even the pain you are feeling in your breast may not even be from the breast tissue. And there are several studies out there that have proven to us, that have shown that when it comes to cancer, breast pain will not be the only symptom that a woman would have. Please don't get me wrong, it might be, but it's not common. It's not common that breast pain will be the only one. There are studies out there. And one of the studies I can remember now on top of my head is a study that was carried out in 987 women whose only complaint was breast pain. These women, they didn't have any other complaint apart from breast pain. On mammogram is an X-ray of the breast. 1% of them had breast cancer. So if you look at 1% of 987, that's about 9 point something. So let's round it up, let's say 10. I'm not saying that is not significant, but compared to 987. So the aim, why I mentioned that, is that when you have pain or anything about the breast, please do not panic. Do not panic. This video is not for diagnostic purpose. It's to educate you. So when you have complaints, any kind of complaints about the breast at all, please go to the hospital. Okay? Now, breast pain. The medical term for breast pain is myalgia. And myalgia or breast pain can be divided into two. There's cyclic breast pain, cyclic from cycle, cyclic breast pain, and non-cyclic breast pain. Cyclic breast pain is related to our menstrual cycle. That's why it's cyclic, because it's related to the menstrual cycle. And during the menstrual cycle of a woman, a lot of changes takes place in the body. A lot of things happen in the body. Hormonal level fluctuates and all of that. And these changes that happen in the body, they affect our mood. The changes affect our energy level. Sometimes you have headache, you break out in acne, you have pimples all over your face. The nipples, your breasts become heavy, and the nipple, they become very turgid and painful. The nipple especially become very, very turgid, like as if they're swollen and painful. That kind of pain that you experience during your menstrual cycle is called cyclic breast pain. Cyclic breast pain. And apart from cyclic breast pain being related to the menstrual cycle, it also usually is bilateral. It will affect the both breasts, because the changes in the hormonal fluctuations that are taking place, they affect the entire body. So it's going to affect the two breasts. That's another thing that you should take note of when it comes to cyclic breast pain. Also, this pain is usually the intensity of this pain varies throughout the duration of the menstrual cycle. So as you approach your period, like the main day that the period you will see your period, the pain is much more severe as you approach. So it's related to your menstrual cycle, it's painful when it's close to your period, and it's bilateral. So if you are someone like me, for instance, whenever I see my period, I will mark it on my calendar. So marking it on the calendar can even help you keep an eye on your cycle And so when you have breast pain around that time, you can go to the calendar and see, am I approaching my period? And if the answer to that is yes, then you will know that this kind of pain you are feeling is because your your menstruation is approaching. Is because you will soon be seeing your period. That is it about cyclic breast pain. The other kind of breast pain is the non-cyclic breast pain. This one is non-cyclic because it is not related to the menstrual cycle. So whether you are on your menstrual cycle, whether you are not, whether you are expecting your period or not, this pain can just come at any time. Usually it's unilateral. It affects just one breast. It affects just one breast, and no reason why we should pay attention to it. Because if it's affecting something is affecting just one breast, then there is something actually not right. So it's usually unilateral and it's not related to your menstrual cycle. Another thing about this non-cyclic breast pain is that it may or may not even be from the breast tissue. So let's look at instances where it can be from the breast tissue. For instance, ask yourself, have you had surgery on your breast before? Now, if you've had surgery on the breast before, the pain may be coming from the incision site, but that does not mean that you have cancer, That's one. Another thing is a condition they call Mondor's disease. Is an inflammation, phlebitis. Phlebitis means inflammation of the vein that is beneath the skin of the breast. So when this vein becomes inflamed, you will have pain in the breast. Note, this condition is very rare, and it's benign. Benign means it's not cancer. It's not cancerous. That condition is not cancerous, but it's very rare. I'm just saying that's another thing that can cause breast pain, and that kind of pain is actually from the breast when there is inflammation of like the vein on the beneath the skin of the breast. I've given two examples about when the non-cyclic breast pain is actually coming from the breast tissue itself. Now let's look at other conditions that we may mistake for breast pain that are not even from breast tissue. Before I talk about those ones, pain can radiate. That is, it can travel from one part of the body to another. And that's why sometimes, even when somebody is having a heart attack, the pain will radiate to the left. To the left. It radiates, this is my left. It will radiate to the left arm. You feel the pain here. And sometimes, even the left breast, you might be experiencing the pain. Then another condition that you may think that is from the breast, but it's not actually from the breast, like a condition called pleuritis. Now, our lungs, we have these two thin layer membrane that surround the lung. They are called the pleural membrane. There's this little amount of fluid in between the two membrane. So as we breathe in and out, the two membranes, they are around the lung, they surround the lung. So they one slide over the other. With the fluid between them prevents friction. Now, when there is pleuritis, when you hear the word itis at the back of anything, it means there is an inflammation. And when inflammation means what that thing is, the tissue swells up. No. So now when the pleural, now for instance, is now inflamed, it means that the space between the two pleural membrane is now narrowed, it's reduced because they are now swollen. The two membranes are swollen. So as you breathe in, you expand the lung. The two membranes, one is directly rubbing over the other one, and it will give you pain. In fact, the pain is sharp pain, especially on deep inspiration, because when you inspire, when you take a deep breath, you are expanding the lung, and as you are expanding the lungs, you are indirectly, the lung is expanding, and the membrane too, the two pleural membrane, they are also expanded, to allow room for the lungs. So they are rubbing on each other when there is pleuritis, and that can cause pain, and you may mistake that for breast pain. Another thing that you can mistake for breast pain is a condition they call it costochondritis. Now, our ribs, they are attached to the breastbone or sternum at the center of the chest, but they are not connected directly to this sternum. So there is this there are costal cartilages that connect our ribs to the sternum or the breastbone. These costal cartilages, when they become inflamed, that condition is called costochondritis. Costochondritis again can cause pain in the chest, and this pain may radiate to the breast, and you may think that pain is coming from the breast. So there are so many things. It's not just that's why I said the pain may be coming from the breast tissue and may not even be coming from the breast tissue. So once you have been able to establish that this pain is not likely due to my period, you've looked at your calendar, or my period is not close, or I've just had my period, or then you know that something is wrong. You can go to the hospital. Okay, and when I say something is wrong, I want to reiterate it again. It's not necessarily cancer. You might have even had a fall. Ask yourself, have you had a fall so that you landed on your chest? Chest pain sometimes, that pain may, because it's in the chest area, and it can radiate to your breast, and then you think that the pain is coming from the breast. Lastly, I deliberately kept this one to the last. Another thing that we do not pay attention to that usually can cause breast pain is when you are not wearing the correct bra size. When you are not wearing the correct bra size, actually, it can give you breast pain. Growing up in Africa, in Nigeria, I'm a Nigerian. When we want to buy bra, then we just go to the market. When you see bra, you just look at it and think, this one should be my size. And then we test it right there. You try to wear it right there at the market. That does not mean you go naked because you want to test it. I mean, of course, we wear it over our clothes. And once it's your size, you just buy. But do you know that by not wearing correct bra size, you can have breast pain? So that's why in some advanced countries, when you travel out of Nigeria, for instance, like maybe in countries like Canada, in America, in the UK, they have professional bra fitters who they will take your measurements and will tell you the correct bra size, the one that you should be wearing. So that's another thing that you could do. Make sure you are wearing correct bra size. And then there was a study that was done too. I can't remember the number of women who participated in the study. But these women too, their only complaint was breast pain. And 75% of them, not 75%, 75 of these women, they found a relief from the breast pain after being professionally fitted with a bra. So they went to the store, they saw a professional bra fitter, their measurement was taken, and they told them the correct bra size they should be using, and they went to the store to in that study, 75 of these women, they found a relief. So you can see some of the things we do not pay attention sometimes can cause pain, not just in the breast, but in any part of the body. I hope you have learned one or two things from this video today. Please kindly share it with your friend, with your family, with your brother. Your brother has a wife, he has a fiancé. Thank you for watching the video. Please do well to subscribe to this channel. Let's grow the channel together. I promise I will not run away again. Thank you very much for watching. I'll see you in my next video. Bye.